Welcome to our segment. I'm Dr. Nina Taib with Los Angeles County Department of Health, and I'm a clinical psychologist. And with me here today is Kanchi Tate, who's a licensed clinical social worker, also with the Los Angeles County Department of Health. And today we're going to talk about mental health issues that affect mothers and babies. So Kanchi, can you tell me a little bit about perinatal mood and anxiety disorders that do affect mothers?
So perinatal mood and anxiety disorders were formerly known as postpartum depression. In the US, about 15 to 20% of women experience symptoms related to perinatal mood and anxiety disorders, regardless of their race, their ethnicity, age, and socioeconomic status or educational level. And there's a variety of symptoms and signs associated with perinatal mood and anxiety disorders, but they're all treatable. The sooner you get support and seek professional help, the better you can be on the path for well-being. So Nina, can you share with us some of the signs and symptoms associated with perinatal mood and anxiety disorders?
Perinatal mood and anxiety disorders have a whole range of signs and symptoms. And it's important to remember that a woman doesn't necessarily have to have all the symptoms and signs, but that whatever she's experiencing, that they are really impacting her functioning and her ability to really be happy and healthy and also be there for her child. So some of the main symptoms that women experience are deep feelings of sadness and hopelessness and helplessness, even to the extent that they may feel like they want to commit suicide and do not have a desire to live. So of course we want to do everything we can to prevent it from getting to that place. Other symptoms can include anxiety and just overwhelming worrying about everything all the time, and therefore they have difficulty concentrating. And sometimes it even gets so bad that women experience panic attacks. And so the way that those are described by the people experiencing them, it feels to them like they're having a heart attack. So there's chest pains and difficulty breathing, so it's pretty severe. Other symptoms can include just a general lack of interest in life, and so they may not be taking care of themselves or eating or sleeping well, as well as feeling very guilty and feeling very inadequate about themselves, especially in terms of becoming a mother. So what people may see is that they are not interested in their child or interested in taking care of their child. So they may, a lot of times society doesn't understand that it's not that they're bad mothers or they don't care about their child. They're actually going through something very, very serious and biological that they can't be the mothers that they want to be.
So Nina, can you share with us, are there any common causes for perinatal mood and anxiety disorders?
So the exact causes of perinatal mood and anxiety disorders aren't exactly understood, but there are some theories out there and we know it's very real. So some of the theories is that they're caused by genetics or by hormonal levels being dysregulated. Obviously giving birth and pregnancy is very hard on the body, so hormones play a big part in everything happening for the mother. As well, there's a lot of social stressors that are thought to be impacting and causing this disorder, especially if the mother is experiencing a lot of stress, whether it's relationship stress, especially if the relationship has violence involved in it, or financial stressors, or just other stressors from family or friends. Those are really high-risk variables. Again, doesn't guarantee that they're going to necessarily develop this disorder, but do put them at high risk. So Kanchi, what are some misconceptions out there about perinatal mood and anxiety disorders that affect mothers?
So many of the misconceptions stem from a lack of understanding and awareness about perinatal mood and anxiety disorders. Just like any other mental health disorder, there's a lot of stigma and shame around it. For mental health disorders, there isn't a blood test or an x-ray that verifies the diagnosis. So many times when you get a mental health diagnosis, people tend to think that is a personal weakness. It's something that the person has control over, or it's a family issue that doesn't need to be discussed outside the family. However, with perinatal mood and anxiety disorders, this is very real. Moms who have this wonderful baby in front of them, everybody expects for them to be happy and joyful, but sometimes that is not how things happen. What we encourage is, if you are experiencing any symptoms and signs, as you mentioned, to seek help, because the sooner you get help, the better it will be for you and your baby. And for partners and family members, it's important to understand these symptoms and be aware of it so that you can support the person and get the help that the mom needs, so that you can facilitate the attachment between the baby and the mom.
We hope that today's segment's been helpful in providing some information about some mental health issues that affect mothers. We really hope that you are able to share this information with those you love so that those who are suffering can get the support and help that they need. Thank you for joining us.
If you or someone you care about needs help, call the Los Angeles County Department of Mental Health 24/7 helpline at 1-800-854-7771. Your call is safe and confidential.